Hi, today we'll be discussing about diuretics. Diuretics are the drugs that increase excretion of sodium and water from the body by the action on the kidneys. Their primary effect is to decrease reabsorption of sodium and chloride from the filtrate and increased water loss being secondary to the increased excretion of sodium chloride. These are the mechanism of diuretics. Coming to the basic structure of nephron, which filters the blood, which is the main structure in the kidney. Firstly comes Bowman's capsule and that glomerulus, and then proximal tubule, loop of Henle, distal tubule, collecting tubule. Now we'll see diuretics acting directly on the cells of nephron. First comes loop diuretics. Those are furosemide, bumetanide, pyretenide, toracimide, itacrinic acid. What this furosemide do is it decreases the secretion of sodium, chloride and potassium reabsorption from the tubule. So it is mainly used to treat hypertension and edema in congestive heart failure, liver cirrhosis and renal disease. It is a potent loop diuretic that acts on the kidney to ultimately increase water loss from the body. Then comes diuretics acting on the distal tubule. Examples are bendroflumetazide, hydrochlorothiazide, cyclopenthiazide, chlortalidone, indipamide, zipamide, metalazone. These hydrochlorothiazides also used to help in reducing the amount of water in the body by increasing the flow of urine. Some same action as like furosemide action. They stop reabsorption of sodium and chloride along them to be removed in the urine, mainly used to treat hypertension and edema. Whereas furosemide is very effective water pill which makes you to go washroom often, where hydrochlorothiazide is well tolerated water pill that often is a first choice for mild hypertension. Then comes the main drug spironolactone. Spironolactone is in a class of medications called aldosterone receptor antagonist. It causes the kidney to eliminate unneeded water and sodium from the body into urine but reduces loss of potassium from the body. Whereas aldosterone is a hormone that helps regulate your blood pressure by managing the levels of sodium and potassium in your body and impacting the blood volume. In overall, both spironolactone and aldosterone are quietly opposite in action. That means aldosterone is a steroid hormone made by adrenal cortex. It helps control the balance of water and salts in the kidney by keeping sodium in and releasing potassium out from the body. Overall, spironolactone decreases the reabsorption of sodium and chlorine, and aldosterone increases the reabsorption of sodium and potassium secretion in balancing the blood volume. So, spironolactone is a specific pharmacological antagonist of aldosterone acting primarily through competitive binding of receptors at aldosterone dependent sodium potassium exchange site in distal convoluted tubule. This leads to increased sodium and water excretion but more potassium retention. In this way, spironolactone acts. Then comes to other main drugs, triamtrene and amiloride. Like spironolactone, these two have limited diuretic efficacy. They act on collecting tubules, inhibition, sodium reabsorption and decrease potassium excretion. Some of kidney diseases where we face is chronic kidney disease, where kidneys are damaged and cannot filter the blood. due to excess fluid and waste from the blood remain in the body and may cause other health problems such as heart disease and stroke. What are the drugs used in this case are angiotensin converting enzyme inhibitors. Examples ramipril, enalapril, isinopril. Mainly, what is angiotensin converting enzyme inhibitors are used to relax veins and arteries to lower blood pressure. What is angiotensin is it's a protein whose presence in blood promotes aldosterone secretion and tends to raise blood pressure. Then automatically when blood pressure falls, kidney releases enzyme renin into the blood. What this renin do is it helps in converting angiotensinogen produced in liver to angiotensin. And then what we have seen after release of angiotensin, it's a protein whose presence in blood promotes aldosterone secretion. What aldosterone does, it increases sodium absorption to maintain blood volume. So now angiotensin converting enzyme inhibitors are mostly used to treat the blood pressure by reducing the secretion of aldosterone. Examples again ramipril, enalapril, isinopril, prils. As we have seen, chronic kidney disease and the drugs which are used to treat that. And then comes kidney stones. We often listen. They are hard deposits of minerals and acid salts that stick together in concentrated urine. That means crystal forming substance such as calcium oxalate and uric acid. Examples to treat that condition are tamsulosin, dutasteride in combination with tamsulosin, where what they do is they relaxes smooth muscles around the structures in urinary system and pass urine without any pain, and also they facilitate spontaneous expulsion of the stone. These are kidney stones. And all minor topics in the diuretics is diuretics that act indirectly by modifying the content of the filtrate, and other main drug as like spironolactone is acetazolamide. It is used to treat glaucoma, a condition in which increased pressure in the eye can lead to gradual loss of vision. Acetazolamide decreases pressure in the eye. It is a diuretic and carbonic anhydrase inhibitors, where in overall these type of drugs regulate the pH and fluid balance in different parts of the body. In eyes mainly, carbonic anhydrase inhibitors are classically used in management of glaucoma due to their ability to reduce the secretion of aqueous humor, thereby lowering intraocular pressure. All this pressure is due to release of bicarbonates. So carbonic anhydrase inhibitors are used. Bicarbonate formation influences fluid transport by affecting sodium, possibly by regulating pH for optimal activity ion transport. So blockade of carbonic anhydrase by their inhibitors in local tissues reduces the formation of bicarbonate ions, thus reducing fluid transport and intraocular pressure. Acetazolamide is a carbonic anhydrase inhibitor, that is, drug works to cause an accumulation of carbonic acid by preventing its breakdown. Other normal drugs are drugs that alter pH of urine, sodium citrate, potassium citrate, and ammonium chloride. And coming to drugs which eliminate urate, those are known as uricosuric agents. Example probenicide and sulfine pyrazone. Whereas allopurinol inhibits urate synthesis itself, whereas probenicide eliminate urate, and which inhibits urate synthesis is allopurinol. Mainly uric acid is formed due to breakdown of purines, adenine and guanine. But purines are mainly used in building of DNA and RNA, where breakdown of purines results in formation of uric acid.